Good afternoon, everyone, and thank you for joining us with Jonas Nursing and Veterans Healthcare, the signature program of Jonas Philanthropy. Please note that this webinar will be recorded. Today, we're going to be having a webinar in partnership with our organization of the Alliance of Nurses for Healthy Environments, and their webinar is entitled Reproductive and Pediatric Environmental Health: Opportunities for Prevention and Tools for Nursing Practice. One of the primary areas of Jonas Philanthropies is the children's environmental health. And working closely with our partners, Jonas Philanthropy strives to increase awareness on our commonly used toxic substances, how they're impacting the health of children. And so we wanted to make sure that we acknowledge this important area and make sure that we're providing additional information to all of you so that you can be aware of the things that are impacting and how we can improve our children's environmental health. Please continue to follow us on Facebook and at Jonas Philanthropies, and on LinkedIn at Jonas Philanthropies, on Twitter at Jonas Impact, and on our website at www.jonasphilanthropies.org. And you can also check out our media library, which will have the webinar and additional information available on our organization, as well as all of our priority research areas. Please remember to use your chat function to submit questions today, and remember to mute yourself on your computer monitors. We will have our Jonas staff that will monitor the chat function so that if you have questions, you can submit them there, and we will present them at the end of the presentation. Now I'd like to introduce Katie Huffing, who works with the Alliance of Nurses for Healthy Environments, so that she can give you more information about our presentation and our speakers today. Katie?
Hi, thank you, Althea.
Sure.
And thanks everyone for joining us today. I'd also like to say thank you so much to Jonas Nursing and Healthcare and Jonas Philanthropies for sponsoring us to be on this call today. Hopefully you'll get lots of information and tools that you can use in your nursing practice. And hope that this is the beginning of lots more work together with the Alliance and Jonas scholars. Let's see. Come on. Huh. Oh, there we go. Let's see. No?
Just takes a minute.
Well, as we're getting started, I just wanted to introduce myself really quickly. I'm the Executive Director for the Alliance of Nurses for Healthy Environments. I'm also a nurse midwife. And so I'm very much interested in how the environment impacts reproductive health as well as children's health. And with the Alliance, we're the only national nursing organization that focuses solely on the intersection of health and the environment. We're free to join. Ah, there we go. Yay! Perseverance. This is a photo here of our new crop of Alliance new environmental health nurse fellows. We have 30 fellows from around the country who will be working together over the next year on researching environmental health issues and coming up with projects in their communities around environmental health, as well as educating their colleagues on environmental health nursing. So we're really excited about this. We have 4 main work groups at the Alliance. We're free to join, and we'd love to have more Jonas scholars working with us. It can be a really great addition to the work that you're already doing. Our research work group has both novice up to very experienced researchers. They'd love to mentor novice researchers, lots of great information. Our education work group has faculty from around the country looking at how to incorporate environmental health into nursing practice. Our policy and advocacy work group works on policy issues of immediate importance, and lots of great activities like calls you can make, testifying at hearings. And then our practice work group has webinars. We have a new podcast, Nurses for Healthy Environments. I'd love to have all of you start listening to that. Beth Schenk every week interviews a nurse about different environmental health work that they're doing. So it's a great way to be inspired. And then finally, on our website, we have tons of resources free to use. We have Environmental Health in Nursing e-textbook. It won the AJN Book of the Year in Environmental Health in 2017, and we're working on a 2nd edition right now. We have a climate change committee, a new food and agriculture committee. So, you know, if you find listening to this webinar or the previous webinar a couple months ago that Barbara Sattler did on general environmental health, you know, please come check out our resources and join us. We also have lots of free continuing education. So lots of great ways to stay connected. And then with that, I'd like to introduce our first speaker, Dr. Laura Anderko. She's a professor at Georgetown University's School of Nursing and Health Studies, where she holds the Robert and Kathleen Scanlon Endowed Chair in Values-Based Healthcare. She's also the director of the Region 3 Pediatric Environmental Health Specialty Unit, the first nurse to be a director of one of the regional PACUs. They're called the Mid-Atlantic Center for Children's Health and the Environment. She has done so much amazing work. She's been on numerous boards. She's represented nursing on a number of federal advisory committees. In 2013, she was recognized by the Obama White House as a champion of change for her advocacy efforts in climate change and public health. She's also currently working with a former Jonas scholar, Dr. Kelly Jones, who's doing a postdoc at the Georgetown Environment Initiative in the Socio-Environmental Synthesis Center, where Dr. Jones is exploring the impact of climate change, built environment, and socioeconomic characteristics on childhood asthma. With that, I'll turn it over to Dr. Anderko. Welcome.
Thank you, Katie. I appreciate that. And thank you to Jonas and to Annie for inviting me to participate today. It's an honor. And I'm having difficulties advancing, so let me, there we go. All right. As Katie said, I will be talking about children's environmental health, and our center is sponsored both by CDC, ATSDR, and EPA, and we are grateful for that funding. As Katie mentioned, we serve Region 3, which is the yellow area on the map, and wherever you are located and watching this, there is a PACU for you in your neighborhood. And so look us up. If you have any interest after today's webinar, please feel free to reach out to me directly, and I can connect you with the right people for whatever question you may have. All right. And the goals of the center are to provide consultation and referral, as well as outreach and education, such as today. Again, if there are lectures you need given, or if you'd like some outreach materials, please feel free to contact any one of the centers. We do not charge for our services, and we're always very grateful when people are interested in children's environmental health and reproductive environmental health. So today I'm going to talk briefly about children. There will be speakers following me who will touch base on reproductive environmental health issues. One of the things to keep in mind with children is that they are particularly vulnerable, partly because of their growing bodies, partly because they count on adults to take care of them, but also they drink more water, they eat more food, and they breathe more air per unit of body mass when compared to adults. They also have a longer shelf life, which means if they get exposed in utero, or even before mom and dad get pregnant, sometimes chemicals can mess around with the ovum or the sperm. Those changes last their entire lifetime. And so we need to be particularly careful and cautious with these little ones because those exposures can mean chronic disease from early on. They also have developing stages of vulnerability. So there are growth spurts. Any mom that had a young son who had to keep buying pants for them because they kept growing visually saw how quickly kids can grow. And these stages of vulnerability are particularly important when we think about the neurological development of their brain and their nervous system. And finally, kids have a rapid metabolism. So they metabolize things very quickly, which oftentimes gets into their system and stays there for a long time. Children are more vulnerable because of their behaviors as well. So they put a lot of things in their mouth. They are very active outdoors when compared to adults. So they're rolling in the grass, they're picking up pesticides, they're crawling on carpets that may be stain resistant with all sorts of chemicals, breathing it in and picking up threads and putting it in their mouths. So they're much more vulnerable because of their behaviors as well. I like this diagram because it helps provide a frame of reference, particularly in utero, as we're looking at all of the exposures that mom may be exposed to, such as toxicants, also her nutrition, genetics, and then the social environment, can all come together in a complex way to create the traits and abilities of a child. And we are learning that some of these exposures can lead or are pointing to issues such as learning disabilities. There was an article I published with a number of authors on air pollution, and fine particulate matter, for example, can cross the placenta and can lead to issues in brain and neurological development. I like this graphic too because it does help capture that the environment is all around us. And there are sources of environmental pollution, whether it's a factory, which is pretty obvious, to farm fields that are sprayed with pesticides and nitrogen that gets into our water and creates algal blooms and pollutes the water and pollutes the fish we eat that are swimming in the water. But also, many of us don't think about hospitals as being sources of pollution. They're second only to coal-fired plants in the amount of carbon they put out. They also incinerate things and tend to have unhealthy food options and use a lot of fuel around transportation. And so for those of you working in hospital systems, there are a number of groups, Annie and Healthcare Without Harm, that can help provide guidance in how to reduce that pollution that is produced. Other things we need to think about when we're talking about children, or anyone for that matter, is the issue around what makes them even more vulnerable. So I don't know about you, but if I had a child that was young, I would want them in the colored picture out in nature as opposed to the black and white, which is an actual backyard butted up against an industry. So we need to think about a person's age and their race. We know that race plays a big role in people living in overburdened communities, also socioeconomic status, where that school might be located. I'm working with a community in West Virginia where a school is across the street from a new industry that's going up that will be spewing out tons of pollution once it's built. And also how long and when that occurrence of exposure started. We know, again, early on that those exposures can exhibit as chronic disease later on in life. So what do we know about the pollution, and what are some of the problems that we deal with at our center? I'm not going to list all of these. The primary calls we get are around water pollution and lead poisoning. There's a chemical called perfluoroalkyl substances, which if you haven't heard about, you will, PFAS for short. They're particularly abundant around military bases and get into the drinking water. We also have a lot of calls around mercury as well as mold. So I'm going to briefly talk to you about one of many hundreds of case studies that we get. This one came early on in the creation of our center. You may or may not notice these around your waterways near your home, but they are up. Mercury gets into the water from coal-fired plants is one major way. And as the coal combusts, it goes into the water, creates methylmercury, which is a neurotoxin. So one of the calls we got was from a parent concerned about their firstborn set of twins, both 5 years old. The children were born at term after an uncomplicated pregnancy and had normal APGAR scores. The development was similar in the twins until they were about 3. And then one of the girls' speech had been delayed relative to her brothers. And we know that girls tend to speak much more fluently and quickly than boys. The parents were concerned because they admitted she was a picky eater and that all they could really get her to eat was tuna fish. And she estimated that the girl had eaten 5 to 7 meals a week with tuna fish from 2.5 to 3.5 years of age. What we know is that a 45-pound child that eats 1 can of tuna per week has exceeded the EPA recommended dose of methylmercury by almost 4 times. And so we knew with pretty much certainty that this child had methylmercury poisoning. So we advised the parents to eliminate the tuna from the child's diet. Unfortunately, there were neurodevelopmental delays, including her speech as a result of this fish consumption and an excessive amount of methylmercury intake. This is one of hundreds of case studies and cases that we consult on. If you're interested in more information, this is our website. Our toll-free number is in the corner. Please check us out and feel free to call us at any time for more information. There's also a website where our PACU network across the U.S. Has free online courses, webinars, and fact sheets. These courses and webinars are available for free CE, so check it out. And I thank you. And this is our phone number, our email, and our website on the screen here. Thank you very much.
Thank you, Laura. And next, we're going to have Sandy Worthington. She has focused her career on reproductive health and education. She's a women's health nurse practitioner as well as a certified nurse midwife. She's educated over 1,000 nurses to become women's health nurse practitioners. She's had such an amazing career. She directed the first colposcopy education course for advanced practice clinicians in the US. She's developed numerous continuing education programs for health providers of all levels, including things like Environment and Health, the Green Choices Program, HPV, A New Era in Patient Care, and clinical breast screening courses. She earned both her undergraduate and graduate degrees from the University of Pennsylvania School of Nursing. She was the chair of the Women's Health and Nurse Practitioner Test Committee of the National Certification Corporation and served as on the NCC Board of Directors. She's been on the board of directors for a number of women's health and environmental health organizations, including the Alliance of Nurses for Healthy Environment. So we're thrilled to have Sandy Worthington on today's call. Sandy?
Thank you, Katie, and thank you to the Jonas Foundation for sponsoring this webinar. Well, as Laura said, you know, we're surrounded by toxic chemicals. We almost live in a stew of it. And all the things that she said, all the different things like our food, our pesticides and cleaning, our electronic devices and so forth are surrounding us all the time. And it starts even before conception. So when we have an exposure, especially like when somebody is pregnant and the embryo and the fetus is exposed to toxicants, it can affect them throughout their life. At different times of the life, they may exhibit signs and symptoms of something they were exposed to way back when they were a fetus. And some of the links between chemical exposures and reproductive health we found in females exhibit more fibroids, endometriosis, abnormal reproductive health development, early or delayed puberty, menstrual cycle irregularities, premature menopause, cancers, intrauterine growth retardation, and miscarriages. And for males, there's an increased incidence of hypospadias, undetended and descended testes, testicular dysgenesis syndrome, anogenital distance, low sperm count, hermaphroditism, and prostate cancer. And we know that infertility is on the rise. More men and women today are having trouble getting pregnant. Sperm counts appear to have steadily declined since the 1930s. And impaired fertility among women increased almost 2% since 1982. Impaired fertility among women under 25 and between 25 and 35 has increased significantly. And an estimated 3 to 10% of women have endometriosis, which is the leading cause of infertility. And the annual number of reported miscarriages and stillbirths have been significantly higher and on the rise. And we have more premature births in infants with low birth weight. Premature birth weights have increased significantly. Premature births are rising among whites and Hispanics, and they're the highest among African Americans. And the number of infants born with low birth weight increased. Low and very low birth weight are rising among all racial and all groups, socioeconomic groups. We know for pregnant women, increased exposure for environmental toxins due to their changing physiology during pregnancies make them more vulnerable. There's decreased mobility of the GI tract, which causes it to be delayed in transit. The delay can lead to greater absorption of these toxins. And change in renal elimination, changes in maternal liver, metabolism, and variations in uterine blood flow can affect her ability to detoxify and clear toxins from her body. And as far as the embryo and the fetal development goes, toxins affect both the structural development and the biochemical function of cells and fetal organs. And if you remember that the first 8 weeks you're an embryo, and that's when you're really developing every major systems, your neurological system, skin, major organs. And a lot of women don't even realize before 8 weeks that they're pregnant. So even if they were trying to be very careful about their exposures, they might not even know they're pregnant. The magnitude of the exposure, the dose of the toxin, and the stage and the metabolism of the mother and embryo all interact to vary the risk and the outcomes. And the blood-brain barrier is not fully developed in the embryo, allowing neurotoxins greater access to the fetus. And prenatal exposure to environmental contaminants can adversely affect the fetal epigenome and put the fetus at risk of diseases and disorders throughout their lifespan. So I'm not going to read all these, but if you take a second to look at, these are some of the commonly identified chemical exposures and their known birth defects that they cause. And these are all ones that I think that you can all recognize. So one example is endocrine disruptors. And endocrine disruptors are chemicals known to interfere with the development and reproduction and may cause serious neurological and immune systems. The disruptions occur because such chemicals mimic the hormones in the body, including the female hormone estrogen and the male hormones and thyroid hormones. So you can see you have receptor cells on the cellular level, and normally they would be activated directly by the hormone. But because the endocrine disruptive chemicals, they go in and they connect with the receptors. So the output of the hormone is totally different. Fetal exposure to endocrine disruptors can cause fetal growth retardation, childhood obesity, hyperactivity, learning disabilities, cancer, infertility, early puberty, and impaired immune function. And here are just a few examples of some endocrine disruptors and what they're commonly used in. Also, climate change affects pregnancy. If you think about the different climate change events, heat-related impacts, the body in the pregnant woman already has trouble with body temperature regulation, and extreme heat is associated with adverse birth outcomes. Drought and flood risk. During these times, you have limited safe water and sanitation, and increased exposure to toxins, mold, access to safe food, and psychological stress. And just the stress if you have a flood of being evacuated from your home and having to find other living conditions will greatly affect the pregnant woman. And the maternal risk of anemia, eclampsia, and spontaneous abortion. And then there's infectious diseases that are caused by climate change. There's increased risk of airborne diseases, and they're more vulnerable to vector-borne diseases such as Lyme's, dengue, and Zika. And therefore, there's an increased susceptibility of fetal microencephaly. Also, extreme weather events that we're seeing more and more. There's increased dehydration and maternal renal failure, increased fetal growth retardation, and preterm birth. And the air quality, increased sensitivity to wildfire smoke, inhaled particulate matter associated with low birth weight, and food insecurities. We have a decreased access to nutritious food when we have these events. And poor nutrition related to delivery problems, low birth weight, and infant mortality. As far as breastfeeding is concerned, the CDC still recommends, despite the presence of chemical toxins, that breastfeeding, women should continue to breastfeed. But I think you need to go on a case-by-case basis as to what the exposure was and how it's affecting the mom. So I believe that environmental health risk and education is part of every well woman reproductive health exam. And when you're seeing a lot of patients, and have a lot of patients in the waiting room, you have a limited amount of time that you can spend with each client. So you have to think of ways to streamline your risk assessment. And there are many tools out there that you can do risk assessment tools. But I like to break it down to really talking to the woman about these portions of her life: her community, her home and hobbies, her occupation or the school, personal things, and socioeconomic groups. So with the community, where do they live? What industries are around them? Are there landfills? What businesses? Are there hazardous substance spills? Do they live in farm country? And what are their recreational areas? Kind of the picture that Laura showed you, that one child was playing in a beautiful scene in nature, and the other was in the playground next to a factory. So find out where your client lives and then focus on that particular area. Also, home and hobbies. If they have a home, do they garden? Do they use pesticides for their hobbies? Do they use glue adhesive? What are their cleaning products? Do they have flame retardants in their home? Are they exposed to renovations? Certainly renovations during pregnancy can stir up all kinds of things. Do they have carbon monoxide detectors, radon? And is there cigarette smoke in their house? And then where do they work? Or where do they go to school, or where do their children go to school? What are the chemicals around there? Are there radiation exposures? Are there any biological agents? Just like think about in the hospital, as Laura said, one of the most toxic places to work is in a hospital. Are there pesticides around schools? What are their building materials? What's their waste management program? And how is their ventilation? Also, talk about their personal life and screening them for their dietary history, alcohol use, tobacco use, prescription and non-prescription medications, substance abuse, insect repellent, sunscreen, cosmetics and personal care products, and personal hygiene products. And lastly, their socioeconomic issues. Do they live in an area with high poverty? Do they have say about what's going on in their community? Do they have any control? Do they have inadequate housing or poor access to health care or clean water? Are they living in higher levels of pollution? And what is their exposure to lead and asbestos? And do they have a limited amount of nutritious food available? And what is their vulnerability to other factors? These are just a few of the screening approaches that I think most healthcare professionals really need to focus in on. Education is a whole nother thing, and because of the limitation of time of this presentation, we can't go into all the education, but here are some resources that you can tap in to get additional information for screening and for education. And I'm going to hand this back over to Katie.
Great, Sandy. Thanks so much. And next we have our next Sandy, Sandy Kreisenbach. She has her DNP. She's also a family nurse practitioner. And she received her Bachelor of Science in Nursing degree from University of San Francisco, Master of Science in Nursing and Family Nurse Practitioner degree from Holy Names University, and her DNP and Psychiatric Nurse Practitioner degree from the University of San Francisco, where she was also a Jonas Scholar. So we're thrilled to have her. She's an ANCC board certified psychiatric mental health nurse practitioner. And about 10 years ago, she started working in Dr. Lynn Milkey's autism clinic as a registered nurse, at which time she was inspired to become a nurse practitioner. And I'm really excited to be hearing about how she's incorporating environmental health into her work as a family nurse practitioner and psychiatric mental health nurse. So welcome, Sandy.
Thank you. Can you hear me?
Yes.
Yeah. Okay. I'm honored to be here before you today with like-minded individuals talking about this important subject. And I thank the Jonas family or foundation and Annie for allowing me to speak about something that I feel is very, very important. And I feel like a number of health conditions that I see in my clinic could be prevented if we instituted the adequate prevention measures. So I work in a clinic, an autism clinic, as an autism specialist, and having the degree of being a family nurse practitioner and a psychiatry nurse practitioner really plays a role when I'm seeing kids that are exposed to toxicant exposures, and because I not only see the health issue, but I also see the psychiatric issue as well. And many people just look at that and say, okay, we're going to give them medicine, and rather than look at the whole environment. So I don't really know how to use this. Hold on. How do I do this? Sorry. Okay, so I'm going to be incorporating, Katie, how do I go back? Do you know?
Hit the back button.
I don't know how to do the back button.
Like on your, like, there you go.
Okay, so I'm going to give a couple cases today, and as I was listening to the wonderful presentations before me, I jotted down a few things that I thought, oh, it would be worth mentioning, these things that were touched upon. So my first case is I had a 3-year-old that was diagnosed with autism, and he lives in the Central Valley of California. And in my clinic, I look for cause for their symptoms. So I'm looking for heavy metals, I'm looking for mold, I'm monitoring their environment, along with looking at their medical health issues. And so the first appointment, I asked the parents, where do you live? They said, in the Central Valley. And I said, are you exposed to pesticides? Yes, we're exposed to pesticides. We back up to an almond orchard. What kind of water are you drinking? Oh, we're on a well, everything's okay. And I said, okay, well, let's get that tested, and let's get, I have a couple of tests that I look for chemical exposures. Also at the same time, I asked if you like questions as far as, Mom, do you like, or does the family burn candles? Oh yes, we love the smell of that. We're always buying them on Amazon. We always have it burning. I asked what kind of food source that they were eating. Like, is it non-GMO or is it organic, non-organic? And at that time, when people are telling me what their lifestyle is, and I'm at that time talking about preventive measures. Looking at, well, what do you store your food in? Wi-Fi, smart meters. I know there isn't a lot of studies out on that, so I'm not really going to touch on that. But I do want to say, in clinic, I have a lot of people that come in and say, when we turned off our Wi-Fi at night, when we turned off our breakers at night, when we removed our smart meter, we felt a lot better. So I'm kind of interested in looking further at that in the future, because I really seen that in clinic. Also, I asked about chemicals, like what kind of do you clean, what kind of chemicals do you clean with? Mom said, oh, I love the smell of pine sol. I mop my floor every day in pine sol. I also asked as far as like, what kind of clothing is your child wearing? Pajamas? Have you purchased a new couch recently? Is it older? Older couches I know have flame retardant in them, or material in them. And mold is a big one. So when I'm seeing a patient, I'm asking all those type of questions. And in my case number 1, this child had every single problem. and so from there, I did, when I did what's the word? Address these toxicant exposures, he did get better to the point where I didn't see him after a year because they moved. I know some people can't move. Mom obviously wasn't cleaning with Pine Sol anymore. He wasn't wearing flame retardant pajamas. He was eating organic food. And it was just remarkable to see the change from a child that couldn't even talk, that couldn't even look at you, that had extreme GI issues and autoimmune-like presentation, and that all had changed in a short period of time too. Another one is I see mold a lot in my patients, and there is a test that I can do to check for mold. I see people that have they run a humidifier a lot, and with a humidifier, there is a lot of mold underneath the carpet. I see some people that love to clean, and they clean their carpets a lot, and that the mold forms underneath the carpet because it's wet. I've had several people. I actually had one patient that presented with bipolar-like symptoms, depression and anxiety, extreme agitation, harm to himself and others, and we suspect it's from the mold from underneath the carpet on the stairs, because when he was removed from that environment, he didn't have those things anymore. Again, I already touched on Wi-Fi, chemicals in Roundup. I have a special test that I'm doing, and I see a lot of children that are high in that, and when removing chemicals and Roundup, they do better, not only mentally, but they do well physically. I see a lot of autoimmune conditions that come in. Okay, the workplace. So we already talked on the workplace as far as the hospital, but I thought it was interesting just to be able to ask people, like, hey, do you use anti-disinfectant gel? Parents that were working in the hospital that are touching chucks a lot and around chemicals, and how we already talked about that as far as prenatal exposure and how that could pass on to the child. I've jotted a few things down when I was listening, and as far as some of the other things I've seen in clinic, one child tested positive for lead to the point where it was so high that the health department came into the home, and they found that it traced back to a spice that they got overseas. So it is good to, not only ask the questions that I just asked on the first slide, but delve a little bit further. I have several children that all they will eat is fish, and their mercury levels high. So talking about how to gear them away from eating that food and eating different foods. Uranium, I see uranium high a lot in children that put dirt in their mouth if they have nutritional deficiencies. It's called pica, or if they eat it. I've also seen uranium high from ceramics. So I've had one family that traced their uranium levels, or the child's uranium levels, all the way back to coffee cups they got at an amusement park. This kind of doesn't relate to children, but it does, because if you're pregnant and prenatally exposed, like I said, to toxicants that can affect the child. I was at a conference with about 10 colleagues. We were all sitting at a table, and every single one of them had hypothyroidism. And I found that quite odd that 10 people from all parts of the world would have that, but we had all worked in the hospitals. So let's see. The recommendations for the future. So mold is, I'm not sure what kind of testing is being, or what kind of studies are being done on mold right now, but that is a very big thing in the clinic that, like I said, that I'm working in. The other thing is that I have people say, oh, I'm in a new house, so I don't have mold. And you'd be surprised how many people test positive for mold, and it's from when they're building the house in the winter and the wood gets wet, it can, and then it's sealed, it can, there's mold that can grow. Let's see, we talked about the workplace, the school. I've had a lot. I had one class, like a complete class, like 40 children come in to see me, and they were all worked up for mold exposure. There was mold in the air ducts, and they were very, very sick, and it was presented like autoimmune-like conditions. Another thing is in dorms. I see that as well in air ducts. Even in cars, I ask people like, okay, how old's your car? Did you spill in your car? That sort of thing. So I think that the thing I'm the most interested though, and because I hear this all the time, is the Wi-Fi. So everybody listening to this presentation, if anybody's interested in looking at Wi-Fi exposure or prevention, please get in touch with me because I'd be interested in doing that. I'm studying that in my clinic. Thank you for your time.
Thank you, Sandy, and thanks to all of our speakers. This was very interesting, and I really liked hearing about the case studies that you presented at the end, Sandy, because I think sometimes, if you haven't been working in the environmental health space, you may have patients that present with these different symptoms and not even recognize to assess for some of these environments that can have such an obviously significant impact on their health. So thank you. Althea, did we have any questions?
Yes, we do. And again, thank you to you all. We do have a question that has come up about Roundup. I know that was mentioned in the presentation as one of the chemicals. So one of the viewers on the webinar has asked about a special test that is used for Roundup. Can one of you maybe speak a little bit about that? Okay.
Laura, are you able to answer that?
We should be able to hear you now. Sorry.
Did you ask me, Katie?
Yeah. Do you know anything about a test for Roundup?
No, not specifically, but there are labs that will test. I would encourage whoever's asking the question to reach out to me, and I can connect her with the regional ATSCR office who can lead them to a lab that can test for that. Roundup is made of glyphosate and other chemicals, and many clinics do not test specifically for these chemical families. So oftentimes you have to go to a special facility that can run those labs. And I don't know, Sandy, if in your clinic you have a lab you work with routinely, but usually if it's something like a pesticide poisoning or potential, we'll connect with our CDC folks and find out where the labs are for that particular test.
I have a couple tests that I do, but they haven't been proved to be valid and reliable, although all my colleagues feel that it is valid and reliable. So there is a few that go through commercial labs, and not for Roundup, for chemicals, but the ones I do for the molds and the Roundup, they go through, like I said, different, kind of like integrative labs. And I think that we want to take that with a grain of salt when we're looking at it. But there is more advancement towards looking at more commercial labs to do it.
Great. Well, thank you so much for sharing that information. I think that was definitely helpful. Another question that came up was about any reversible effects. It sounds like in the presentation, a lot of the effects that could be developed from being exposed to toxins may be reversible. Would any of you be able to comment on that?
I can comment on it from a clinical point of view. So, especially in children, their healing is faster if you can remove the presence of the toxicant exposure. So if you remove those things, I've seen, or when I've seen these things removed, kids aren't walking around with brain fog, and so they're learning better. They're advancing, or they're exceeding their milestone, or although their milestones were delayed, they're moving forward in the right direction. There are certain things that you can do to help, other than prevent these exposures. Things like antioxidants, special diet, vitamins and minerals. Those can all play a role in reversing the effects of some of these toxicants, because you can remove the toxicants, but they might have affected the individual. And when you add on some things to help get them stronger, and I've seen reversement.
Thank you.
Yeah. This is Laura. I agree. If it's an acute exposure, and you can remove that exposure, you're much more likely to see improvement and healing. Oftentimes, parents have gone through sort of traditional medical systems where by the time they figure out what the exposure is, it's really late.
Mm-hmm.
And so the example we gave with the fish, that little girl was eating fish 5 to 7 times a week for a year. Now, if we would have caught it early on, I know adults who've been able to reverse those impacts through vitamins and not eating fish. But with kids, they are super resilient, but they're also very sensitive. And it goes back to sort of where in the windows of vulnerability they're at, where they're in their growth and development, what the dose is, how much they've been exposed to it, and other issues. Do they live in a poor community with additional environmental exposures? Are they poor? Are they not eating well? These things all, add to a complex mixture of risk. And so it's better for us to prevent these exposures. Honestly, my mantra is we need better policies. We need better national policies around chemical exposures. Chemicals are not tested for human health impacts. They're not required to do that. So we are literally using our children as canaries in the mine. And so is that the kind of policies that we want to sustain in our country? I don't think so. I think if people knew that, that they would be upset that it's not safe to buy chemicals like Roundup, and now it's getting out in the news. But how many hundreds of thousands of people have been exposed thinking it was safe because it could be sold over the counter? So our pharmaceuticals are much better regulated than our chemicals, for sure.
To piggyback on that, is that it's a wide array of things. It's usually not just one thing. In clinic, it's very difficult for a clinician to, given that we don't have a lot of time, address all these things. It would be great to, I've seen some tools when I was in my program that touched a lot of these, but not all of them. So it would be good recommendation for research moving forward about how we can institute that in the clinical practice of assessing all these things, because it's usually not one thing, it's sometimes 10 things, and getting the patient to get the education as well, while being able to see patients after that. Because I find that when I'm doing that, I really want to help these people, but it's like it takes hours to go through this stuff. So I'd love to see how we can do it in a more timely fashion.
I think that's definitely a great point that you bring up, that there are so many things that can have an impact, but we don't have that much time in terms of addressing every little thing. And then there are some things that are just beyond our control. But it's good to know that at least to a certain extent, sometimes some of these things can be, some of the effects can be reversed at, during certain points in time. One of our participants included a comment saying that there was mention at the beginning about Annie being the only organization interested in health and the environment. And they just wanted to point out the American Association of Occupational Health Nurses having a long history and having an environmental focus as well, along with occupational and environmental health nurses, and being concerned about environment and socially responsible in business and protecting the health of workers and the population. So did any of you want to comment on that, or maybe?
Yeah, I'd like to clarify. I didn't mean that we're the only organization that is interested in this. We're the only nursing organization that has environment and health as our sole focus. And we actually work a lot with the Association of Occupational Nurses. We work with many of the major nursing organizations on different environmental health issues that would be of interest to their members. So we're very much focused on a collaborative model, and our organization was actually created out of a meeting where many of these nursing organizations were in attendance, and nursing unions where they felt that the best way to lead the nursing profession on environmental health was to create the Alliance of Nurses for Healthy Environments so that they can help be that coordinating body, but not to negate all the awesome work that other organizations have been doing on this issue.
Okay, great. Thanks, Katie. We understand it was definitely probably a collaboration there. So
definitely.
Some history there. We have one last question from one of our participants here with us. Would you go ahead?
Hi, yeah. My name is Jean Churchill. I teach pediatrics at the School of Nursing here. Do you use ways to help in evaluating the environment? Like, for example, they send out for asthma, patients with asthma. So maybe the time could help be cut back, that you have to allocate for that visit. If some of that they could come in, or at least you could send out visiting nurse to do some of that type of environmental hazards type of check.
Yeah, this is Katie again. I know that talking with nurses that do some of the Healthy Start visits or that participate in things like the Nurse Family Partnership are looking to expand that type of assessment and teaching with their clients. So, and I think it's such an excellent opportunity to be in the home and to be able to do those types of assessments and guidance. So you're right. And I think it's a great opportunity too to use things like community health workers and others within the community to help facilitate some of that education.
Yeah, and just to dovetail on that, Katie, the Mid-Atlantic Center has received some special projects funding from US EPA, actually Region 3 EPA, and we're in the throes of organizing some Healthy Homes outreach and education events. Lois Wessel is our family nurse practitioner working on that, and it's going to be done in both English and Spanish, specifically directed towards community health workers. And so that's a great point, is that, kids spend a lot of time at home and in schools. If we can get at least a home assessment and evaluation, we can educate around reducing chemical cleaners, for example, and no smoking in the house, and not using pesticides in the house or on the lawns, things like that, that will really help improve that child's health. And so there's a lot of good work in that space around healthy homes. If you just Google it, you'll see there's a lot of national groups as well, but there are a lot of nurses working in this space as well.
So much. And thank you all for joining us today. This has been a great presentation discussing the environmental health and the exposures and the toxins and how we can work more towards prevention. We definitely appreciate you, Katie Huffling from the Alliance of Nurses for Healthy Environment, and Annie for joining us. And also to our presenters, Laura Andeko, Sandy Worthington, and Sandy Kreisenbach. Thank you all very much for sharing your information and your work with us today. And thank you to all of our participants. We're very happy that we were able to have this opportunity to actually share this webinar with you. Again, feel free to visit our website at www.jonasphilanthropies.org, and we will at some point soon make this webinar available as a recording there. All right, everyone, have a great day. Thanks again.
Thank you.
Bye-bye. Thank you.
Bye.